Okay.
Okay, my name is William Mpaji. I'm gonna talk about the 5 muscles in the upper body, the origin, the insertion, and the action. I'm gonna start with pectoralis major. This is the muscle. This is the major muscle of the anterior chest wall, right here. So its origin is clavicle, that's the collarbone, sternus, the chest bone right here, then the upper lips right here. The insertion is humerus, that is upper arm bone right here. Then the action, it helps to move the arm across the chest like this. Then another muscle is called trapezius. This is the flat muscle that runs from the upper back to the neck, just right here, upper back to the neck right here. The origin is base of the skull, that is occipital bone, all the way this way. Then the insertion is clavicle, that is insertion is clavicle, that's collarbone right here. Then the action, it helps to move the shoulder and supports the neck. Then it supports the neck right here. Then the third muscle is called latissimus. It's called latissimus dorsi. This muscle, it runs from the mid to the lower back, from the mid to the lower back down here. So that's latissimus dorsi. The origin is lower spine. The pelvis, that is iliac crest here in the hip. Then the lower ribs down right here. Then the insertion is humerus, that is collarbone right here. Then the action, it pulls the arm downwards and backwards. So that's its action. Action. It pulls the arm downwards, then backwards. Then the fourth muscle is called subscapularis. So this is the muscle in the rotator cuff right here. This is the muscle in the rotator cuff right here. So its origin is subscapular fossa right here. Subscapular fossa. This is the front of the shoulder blade right here. Then the insertion is humerus, the collarbone. Then the action, it helps to move the arm inwards, like this. It helps to move the arm inwards. So the last muscle is called supraspinatus. So this muscle also is a part of the rotator cuff right here. The origin is supraspinatus fossa, the upper on the up of the shoulder blade right here. Then the insertion is greater tubercle. That's the greater tubercle of the humerus, the collarbone right here. And the action, it helps to raise the arm like this. So that's its action, to raise the arm like this. So that's the 5 muscles in the upper body. So right now I'm gonna do the knee eval as well. I'm gonna have my partner to sit down here. So in the knee eval, first of all, I'm gonna ask the past, present, OPQR, ST, and sample questions. What is OPQR, ST? O stands for onset. What were you doing to get the injury? P means provocation. What makes it better or worse? Then R means radiation. Where does it go? OPQRS. Then S means severity. Rate your pain. Then OPQRST. Then T means time. What time did you get the injury? Then sample means S means signs and symptoms. A means allergies. M means medication. P means past medical history. Then L and E, the event lead to the to the injury or the incident. So secondly, I'm gonna start with inspection, swelling, discoloration, and deformity. Is there any change in color? Is there any change in size? Then after that, I'm gonna go for bone palpation. Bone palpation, I'm gonna start with the tibia bone right here, the plateau and the tuberosity and shaft all the way down here. Then I'm gonna check the femur bone here, the condylus and the shaft all the way down. Then I'm gonna check for patella. I'm gonna check for patella, the borders and the body. Then after that, I'm gonna check for fibula, the head and the shaft all the way down. So after that, I'm gonna go for soft tissue. Soft tissue, I'm gonna start with medial collateral ligament inside right here. Then lateral collateral ligament outside right here. Then after that, I'm gonna check Mansky eye joint, both medial and lateral. Then after that, I'm gonna go for patellar tendon up right here. Then after that, I'm gonna go for I'm gonna check for quadriceps, for popliteal fossa at the back of the knee right here. Then I'm gonna check for quadriceps. This is rectus femoris right here, vastus medialis here, and vastus lateralis right here. Then I'm gonna check for Ansolini group. That is sartorius here, gracilis, and semitendonitis besides right here. Then after that, I'm gonna check for hamstring at the back of the knee. I'm gonna check for biceps femoris at the back, semitendonitis sides here, and semimembranosis all the way back. Then I'm gonna check for the iliotibial band all the way from the joint, from the hip all the way down. So after that, I'm gonna go for range of motion. I'm gonna do it actively, active range of motion. I'm gonna have her put her knee in flexion, that is 135 degrees. Then knee in internal rotation, pull. Then 10 degrees, then external 10 degrees, then knee extension 0 degrees. Good. Then after that, I'm gonna go for muscle action. I'm gonna do resistance range of motion. I'm gonna have you put your knee in extension, in flexion. Here I'm checking the hamstring, biceps femoris, semitendonitis, and semimembranosis. Put some resistance, like 2. Then I'm gonna go for extension, like this. This is rectus femoris, vastus medialis, and vastus lateralis. put some extension, put some, like, yeah, good. Then after that, I'm gonna go for neurological. I'm gonna check for L2, L4, knee extension and adduction, like this. Then I'm gonna go for L4. This is ankle, those flexion and inversion, like this. Then I'm gonna go for L5, that is toe extension, like two. Then I'm gonna go for S1. I'm gonna go for L5 and S1, that is knee flexion. Then I'm gonna go for S1, that is ankle eversion. Then S1 and S2, that is ankle plantar flexion, like this. Point to me like this. Then after that, I'm gonna check for sensory. I'm gonna start with S1, the lateral lower foot down this way. Then S2, the posterior knee at the back of the knee, that is S2. L3, the medial knee. L4, the lower medial knee. L5, the lateral lower leg, all the way this way. Then after that, I'm gonna check for leaf flex here at patellar tendon. Then Achilles tendon. Should me like this. Then I check the Achilles tendon. That's it. Then after that, I'm gonna go for blood flow, the capillarization. When I place it here, I have to make sure that the blood comes in 1 to 2 seconds. Then I'm gonna check the blood flow at the back of the popliteal fossa, blood flow. Then after that, I'm gonna compare bilateral. So that's what I have today for knee evaluation under 5 muscles. Thank you.